President Trump signing his big, beautiful bill into law, and that carries significant changes for health care programs like Medicaid. Democrats, however, do not like it at all. They are sounding the alarm.
This legislation will cause a $500 billion cut to Medicaid. More than 50,000 people are at risk of dying.
This bill kills seniors, children, veterans, also the richest. The richest Americans can be showered with even more wealth.
This bill represented an unprecedented assault on health care from a group of people who promised not to touch Medicaid.
So Dr. Mehmet Oz is knee-deep, runs the Centers for Medicare and Medicaid Administrator. And, sir, thanks for coming back and joining us on our program. It's been 11 weeks exactly to this day today when we had you on, okay? So you just heard from Democrats. I want to ask you about the criticism, but I want to play something from a Republican senator, Tom Tillis, North Carolina. Didn't like the Medicaid cuts for his people in his state and said this as he voted no.
Now it's like if you like Medicaid and you're eligible, you can keep it. That's fundamentally untrue because the funding mechanisms are probably going to take people who are eligible for it off of it over time, or it's going to create an enormous unfunded mandate on the states in a time frame that they can't absorb.
You know, you get a chance to respond to all that, whether it's Tillis or the Democrats. Are they right about this? Because you got 80 million Americans on Medicaid, and some predict over the next 10 years, maybe 8 million, 8.5 lose their insurance. What would you say to that, doctor?
I don't believe we're going to have that number of folks lose their insurance, but more importantly, I think we took steps, as the president outlined, that allow Medicaid to thrive. The reason I took this job, I'm a heart surgeon. I spent my life taking care of folks, actually in Spanish Harlem, many individuals that did not have full insurance who are on Medicaid, so I know those challenges. If you want to take care of our most vulnerable, the children, seniors, folks with disabilities, you have to have it in a program that actually works for them. Unfortunately, Medicaid, which we have spent 50% more money on in the last 5 years, isn't able to keep up. We still have hospitals who are struggling despite pouring money into the system, and we have the number 3 cause of death still is medical errors. So we've got to wholesale make the system work better. Just throwing money at it alone is not going to solve that issue. That's one of the reasons that this bill, this act now, created a rural transformation fund, which I'm excited about for many reasons, and others are as well, because we will be able to invest $50 billion transforming how we actually offer care to Americans, dealing with the underlying reasons why we're a sick nation in the first place, from prevention to making sure we shore up rural hospitals, to making sure providers stay in communities that are often underserved, our community health centers, all the places we know we have gaps of care. That's where we should be putting money, not just throwing it into the system and hoping it ends up in the right spot.
I'm going to get into 2 more questions before our show's over. You mentioned rural hospitals. Democrats have been all over this issue. They think that this bill is going to close these rural hospitals. What would you say to that quickly? How will you protect them?
The Rural Transformation Fund is designed to allow hospitals to keep us, especially with information technology advances, ranging from AI to just be able to get the bills sent out in the right way. Rural hospitals have fallen way behind the big urban centers. We need to equalize that by helping rural hospitals keep up with the 21st century.
Okay. I mentioned 11 weeks ago you were on our program, 11 weeks ago today. This is what I asked you at the time before the big, beautiful bill was signed into law. Watch. You say today, are you cutting Medicaid, as Democrats claim, and will continue going up to midterms next year?
President Trump has been very clear with me. He said it publicly. He wants to love and cherish, I'm quoting him, Medicare, Medicaid, these programs. We are focused on saving Medicaid. That's what we've got to do. That's the existential threat, that you spend it into the ground and we don't have the resources to take care of our most vulnerable.
So in the next minute, I know that those enrolled in Medicaid has increased exponentially over the past 5 years, I would say. We are still learning a lot about the big, beautiful bill. I'm going to give you a chance here. What do you believe is the best feature for Americans when it comes to health care?
Well, just to head-on address whether we're cutting Medicaid or not, we're putting $200 billion more into Medicaid. More money is going into the program to help our young who are born into poverty, to help seniors who are struggling with keeping the ends together, and with the folks with disability. The best part about this bill, without question, is it's challenging us to go forward and make a better system that works for all Americans. Not just accept and tolerate the mediocrity where it exists in the old programs that we have funded. And Medicaid is a good example of how we can leap forward to help so many people with better programs for mental health in particular that today are not dealt with because we don't have providers and we don't have systems that work for those folks, our most vulnerable. A great country takes care of its folks who are vulnerable. We're great people. We will do that under this administration.
Hope you come back soon. There's plenty to cover, as you well know. Dr. Mehmet Oz, thank you for your time today and have a good weekend. Thank you.